Hi, thanks for your interest in the intraoral classes. Working in and around the mandible, the lower jaw, is somewhat tricky work and worth learning. It doesn't take too long to get a sense of the geography, but usually it's an area that most of us as beginning massage students, we didn't get a lot of exposure to the structure and the tissue around the mandible and the anterior neck. So as an advanced skill, as a particular skill set to include into your practice, it's a great way to have a niche market, to be known in your community as somebody who can work with migraines or temporomandibular joint, TMJ problems. For whiplash, there's a very strong connection with the back of the neck, the front of the neck, and the jaw functionally, such that people with upper neck problems tend to get jaw problems, and people with jaw problems tend to have stiffness and restriction in their upper neck. So if you can think in your practice of somebody who's got stress and strain in their upper neck, they probably also need some treatment in the front of the skull and the front of the face. A couple of places that are the focus of our treatment when we work inside the mouth are the pterygoid muscles. There's two pairs of muscles. One is the medial pterygoid, and that's what I'm going to show in this quick little introduction. Pardon me while I take the mandible off the skull. But we know we've got the masseter on the outside of the jaw. It's that thick, strong muscle here that when people grind and bite, it gets so tight and strong. We have a partner to that muscle on the inside. The medial pterygoid lives, and it mimics the masseter on the outside. In order to contact that muscle, we ask the client to open their jaw, gently follow the biting surface of the lower jaw back, and that guides us directly to the muscle tissue of the medial pterygoid. Here's what it looks like. So I put on my glove. In this instance, I'm using a vinyl glove. It's one of the things these days to be mindful of is for folks that might have latex allergy or other kind of chemical sensitivities, having some vinyl gloves around is a good thing. Something we discuss all those options in our class. So the client here, my husband Richard, a very cooperative client, go ahead and lick your lips just a bit so the glove doesn't catch. Open the jaw, and I feel with my index finger, I just feel gently for the lower biting surface with my index finger following directly back until my fingertip doesn't go any farther. So you can see with the camera it's quite a ways back, but still comfortable. Yes, Richard? Yeah, so still comfortable there for clients. We don't necessarily need to use a lot of pressure, but we can actually take advantage. I'm going to engage the tissue just a little bit. You can see my hand movement. I engage the tissue a little bit, and then we'll take advantage of the contract, relax reflex. Go ahead, bite down on my finger a little, and then release. And I can feel the muscle relax. I feel it tighten as he bites down. Go ahead. And when he lets go, release, I can feel it all soften. And one of the nice things is that the client also can feel it soften. The change that we get inside the mouth is usually quite vivid for clients. Many of us carry a lot of tension in our face and jaw that we kind of have forgotten about and aren't really quite aware of. So giving people relaxation and stress relief in this area is they can tell that your work is creating change for them and having a positive impact. So even my clients who are shy about intraoral work, they often come back the next week and say, can you do that again? That really made a big difference. I'm not waking up with headaches, or it's easier for me to eat and chew. All different kinds of things, different ways that we can help people with this intraoral work. So go ahead, check out our website, craftedtouch.com, and you'll learn more about the class there. And we'd love to see you in a class and show you this really important work. Thanks.